Hello and welcome back to our channel. Today we are going to discuss another interesting topic in medicine, which is drug-resistant TB. Because we know TB is a global health concern and understanding its different types of drug resistance is very crucial. First, let's understand what is drug-resistant TB. Drug-resistant TB occur when bacteria that cause tuberculosis develop resistance to the drugs that is used to treat them. And so today we are going to look at various drug-resistant TB and we will understand them with ease and with mnemonic. We have 5 groups according to WHO, and these groups of drug-resistant TB can be remembered using the mnemonic monomer and polymer. From the spelling of monomer, we have the first group, which is monoresistant TB, and from the spelling of polymer, we can derive the remaining 4 groups of drug-resistant TB. And so when we say monomer, it is number 1. And from polymer, this is number 2, which is polyresistant TB. And the remaining 3 letters of polymer, we have the third group, which is multi-drug-resistant TB. And we have extensive drug-resistant TB and rifampicin-resistant TB. So these are the 5 groups of drug-resistant TB. Of course, we derive them from the spelling of monomer and polymer. And so we have monoresistant TB, polydrug-resistant TB, multi-drug-resistant TB, extensively drug-resistant TB, and rifampicin-resistant TB. So we are going to explain each and every class of drug-resistant TB. So let's start with monoresistant TB. From the word mono, we know mono means 1. So monoresistant TB is in a situation wherein there is resistance to only one first-line anti-tubercular drugs. And we know the first 4-line anti-tubercular drug can be remembered using the mnemonic RIPE, where R stands for rifampicin, I stands for isoniazid, P stands for pyrazinamide, and E stands for ethambutol. So in any situation wherein a patient is resistant to only one of these, then we can refer that to as monoresistant TB. So the next group of drug-resistant TB can be confusing. Polyresistant and multi-resistant. Because when we say poly, it means more than one. When we say multi, it means more than one. So students most time confuse these two as to which one is which one. And so let us try to understand them in detail. When we say polydrug-resistant TB, it means when you have resistance to more than one antitubercular drug, more than one first-line antitubercular drug other than rifampicin and isoniazid. We have 4 groups of first-line antitubercular drug, which are the RIPE. In any situation wherein you have more than one of these first-line drug resistant, then we can consider it as polyresistant without rifampicin and isoniazid. In any situation wherein a patient is resistant to both rifampicin and isoniazid, then we can consider this as multi-drug-resistant TB. So multi-drug-resistant TB, which in most cases can be abbreviated as MDR, multi-drug-resistant TB, is just resistant to rifampicin and isoniazid only. So, for example, if we want to give example for polyresistant TB, so if we have rifampicin and let me say pyrazinamide, then that is a polyresistant TB. As long as rifampicin and isoniazid are not together, then we cannot consider it as multi. If we have both rifampicin and isoniazid as a resistant, then we can consider that as a multi-drug-resistant TB. So polydrug-resistant TB can be when we have rifampicin and pyrazinamide, or rifampicin and ethambutol, or isoniazid and ethambutol. But if we have only rifampicin and isoniazid, then we can say this is a multi-drug resistant TB. The next drug-resistant TB is the extensive drug-resistant TB, which can be abbreviated as XDR. As the name implies, it's when a patient is having resistance to so many group of anti-tubercular drug, and hence the name extensively drug-resistant TB. And so you can remember this with the formula below. Is in any situation wherein the patient has one multi-drug resistant TB. Of course, we all know now multi-drug resistant TB is a situation wherein patient is resistant to both rifampicin and isoniazid, plus at least one fluoroquinolones. Of course, fluoroquinolones, we know these drugs, they end with fluoxacin. So we have example, levofloxacin, and one of the three injectable second-line antitubercular drugs, and we know the injectable second-line antitubercular drugs, they end with mycin, and we have capromycin, kanamycin, and amikacin. So this is the formula to remember extensive drug-resistant TB. So it's a sum of multi-drug resistant TB plus at least one fluoroquinolone and at least one of the three injectable second-line antitubercular drugs, which are capromycin, kanamycin, and amikacin. You can remember them with the abbreviation CKA. So next, we go to the last, which is the rifampicin drug-resistant TB. So the last group is the rifampicin-resistant TB. So as the name implies, is any situation wherein a patient is resistant to rifampicin and it has been detected using both phenotypic and genotypic method. So with or without resistance to any other antitubercular drug, as far as it has been detected using phenotypic or genotypic method, then we can say this is rifampicin resistant TB. So in that situation, it does not depend on as to either the patient is resistant to other drugs or not. So rifampicin resistant TB can occur alone or can occur with other resistant, but in any situation wherein it has been detected both phenotypic or genotypic method, then we can consider that particular patient as rifampicin resistant TB. Thank you.